Hello, my name is Dr. Nicole Leong.
And I am Dr. Jana Richards.
We are obstetrician gynecologists here at the University of Chicago. You've just been through an incredible journey, and now that you're postpartum, it's time to rest and allow your body to recover. The next 6 to 8 weeks, however, can be a difficult and stressful time, so please remember to practice self-care. Take a break, ask for help when you need it, and try to get as much sleep as you can. Eating healthy foods and drinking plenty of water will help as well. The postpartum period is a time of transition, physically and emotionally, and while most people will recover from delivery without any problems, anyone is at risk for postpartum health complications. With this video, we will review post-birth warning signs and symptoms that should alert you to get help. Recognizing when you should call 911 and get emergency care, and when to call your obstetrician or midwife can save your life.
You have heard from Dr. Jana about postpartum preeclampsia or high blood pressure that develops after delivery. This is one of the most common complications after birth. To review, if you have a severe headache that does not get better with pain medication, rest or hydration, or having changes in your vision, seeing spots or flashing lights, this could be a sign of postpartum preeclampsia. Preeclampsia can result in stroke or seizures. If you witness your partner or family member having seizures, call 911. If you have what feels like the worst headache of your life, call 911 or go to the emergency room right away.
Pulmonary embolism, which is a blood clot in the veins of your lungs, is another life-threatening condition that requires immediate treatment. During the first 6 weeks after delivery, you are at highest risk for developing blood clots in your veins. Some symptoms you might experience if you have a pulmonary embolism are shortness of breath, even when you are at rest, chest pain, or a cough. You may feel like you're breathing very fast or with shallow breaths. Some people may even lose consciousness. If you think you're having a pulmonary embolism, you should call 911 or go to your nearest emergency room right away.
Chest pain and shortness of breath can also be a sign that there's something wrong with your heart. If you're having palpitations, chest pressure, or pain or difficulty breathing, you could be having a heart attack or be in heart failure. You should call 911 or go to the emergency room right away.
We have been monitoring your bleeding while you've been in the hospital. You should continue to monitor this at home. If you're passing blood clots the size of a golf ball or an egg, or if you're bleeding through more than one pad an hour, call your healthcare provider. Of course, if you start to feel dizzy or lightheaded, or your bleeding is just not stopping, or you do not get a response from your provider or clinic, call 911 and go to the nearest emergency room.
If you notice that one leg is more swollen than the other leg, or your leg is red, painful, or warm to touch, especially in the calf area, you should call your doctor or midwife to be checked for a blood clot in the veins of your legs. This is called a deep vein thrombosis. A clot in the vein of the leg needs to be treated with blood thinners. If the clot moves, it can travel to your lung and cause a pulmonary embolism.
Infections are another concern after delivering a baby. Infections can develop inside the uterus, in the vaginal area, especially if you've had stitches, or in the C-section incision, also in the breasts. If you feel sick or have chills, you should take your temperature. A temperature over 100.4 degrees Fahrenheit is considered a fever, and you should call your healthcare provider for further evaluation. If you have a foul-smelling discharge from the vagina, or your incision is red or draining, This is another reason to call your provider. If your symptoms worsen or you do not get a response from your provider, you should go to the nearest emergency room or call 911 if you are severely ill.
The last symptom you and your family should be aware of is that of postpartum depression. Signs of postpartum depression include thinking of hurting yourself or your baby, feeling out of control, unable to care for yourself or your baby, feeling depressed or sad most of the day, every day, having trouble sleeping or sleeping too much, having trouble bonding with your baby. Being nervous or anxious about your baby's health is common. If this anxiety is overwhelming or consuming your thoughts day and night, please call for help. If you feel you might harm yourself or your baby, call 988, the National Suicide Hotline, or go to your nearest emergency room. Call your healthcare provider immediately for other signs of depression. Remember, you are not alone during this challenging transition. There are many people here to help to support you. The sooner you get help, the sooner you can enjoy this time with your new baby.
You are now on your way to recovering from the delivery. Your body has gone through many changes throughout your pregnancy, and it takes some time for you to heal. So remember to rest.
Post this handout you received from your nurse on your refrigerator and share it with your family and friends. Knowing when to call 911 or go to the emergency room can save your life. And remember, you know your body better than anyone else. If something just doesn't feel right or you feel really sick, don't hesitate to call your healthcare provider. And if you can't get in touch with someone in a timely fashion, go to the nearest emergency room or call 911.